regarding antiviral medication, the first medication we are going to discuss are Oseltamivir and Zenamavir. Oseltamivir and Zenamavir. These all are neuroimmunidase inhibitor, and neuraminidase is very much important, as we have discussed this for exit. So it inhibits the progeny release of the virus, and it is given in within 48 hours in order to get the required to shorten the disease. If you give after 48 hours, then it is no longer effective. So like Oseltamivir, there is a new medication known as Baloxavir, and Baloxavir is also given in within 48 hours, but Baloxavir act differently. It inhibits the cap snatching endonuclease and nuclease activity of RNA polymerase, and it inhibits replication process. And Oseltamivir is used in especially used in influenza A and B, and a new medication known as Remdesivir used in the hospitalized COVID-19 patient. And Remdesivir first of all, Remdesivir inhibit is a ATP analog, and this ATP analog, it goes to the new RNA dependent RNA polymerase and inhibit RNA dependent RNA polymerase, which is and which then decreases which then decrease the viral messenger RNA levels and inhibit the replication process. It also evades proofreading, which is done by the exonuclease of the RNA virus. So this is the mechanism of action of Remdesivir. After this, we have the Acyclovirs, and the Acyclovirs are Acyclovir. First we discuss the Acyclo and Famciclo and Valacyclo. They all are guanosine analogs. They all are activated by viral thymidine kinase, which converted into monophosphate, and the cellular enzymes convert this monophosphate into triphosphate, and this triphosphate long chain inhibit the viral replication process as a chain terminator. And the viral tyrosine kinase, if it is mutated, then the virus get resistance against this antiviral medication. So the most effective viruses which are very much killed against Acyclovir, Famciclovir and Valacyclovir are herpes viruses and varicella zoster viruses. And for varicella zoster virus, we particularly give Famciclovir, and they all the Epstein-Barr virus and the cytomegalovirus, they are not pretty much affected by this medication, because they don't have the respective thymidine kinase enzyme. So herpes simplex, and also we have this val. Whenever a medication has a val component, it means that like val acyclovir or val ganciclovir, then val make it a better bioavailable, oral bioavailable medication, denoted by F. And the side effect of these virus, these medication are pretty much they can cause obstructive crystalline nephropathy. There is another medicine, Ganciclovir, which is activated by cytomegalovirus thymidine kinase, and this Ganciclovir is activated against the resistant herpes simplex viruses or cytomegalovirus, and especially given as a prophylactic agent to in especially the immunocompromised patient. So Ganciclovir is used for cytomegalovirus, and the main side effect of Ganciclovir is very much toxic. It is very toxic, especially the renal, and it is especially renal toxic, and bone marrow suppressor, neutropenia, pancytopenia, thrombocytopenia, leukopenia, etc. So this is the mechanism of action of Ganciclovir and Acyclovir and Famciclovir and Valacyclovir. Then we have the Foscarnet and Cidofovir. And in the Foscarnet is actually it does not require tyrosine kinase enzyme, and Foscarnet is actually a nephrotoxic agent, and it is a calcium chelator and magnesium waster, which makes it very much toxic to the kidneys. And the Foscarnet is actually a pyrophosphate. It's a pyrophosphate analog. And Foscarnet is very much effective against HIV reverse transcriptase, along with the viral DNA and RNA polymerases. So whenever the enzyme want to resist against Foscarnet, it mutates its polymerase enzyme. So the low levels of calcium and magnesium leads to SEER, another side effect of Foscarnet. There is also another medication which is known as the Cidofovir. It is also not used. It does not use tyrosine kinase to activate. It is given for the patient which are Foscarnet resistant, or also they are immunocompromised, especially the CMV retinitis and Acyclovir resistant herpes simplex virus. Foscarnet is also used for CMV. When the Ganciclovir failed, Acyclovir failed, we give Foscarnet. And the Cidofovir toxicity is very much it is also nephrotoxic, and this nephrotoxicity is inhibited by using probenecid and hydration. So these all are the antiviral agents. Then we have relatively 3 or 4 lines regarding the hepatitis C therapy. So in hepatitis C for hepatitis C we have first one is RNA dependent RNA polymerase inhibitor, and these inhibitors have a mnemonic, have a very much a suffix. Over here they have Buvir, for example, so Sofosbuvir. So Sofosbuvir is act as a chain terminator of RNA polymerase. Then we have a protease inhibitor, and in the protease inhibitor we have a suffix like Previr, like Simeprevir, and the Simeprevir has a typical uh, side effect, that is rash. So Simeprevir, and then the last one is uh, an agent which inhibit replication inhibitor, and it is the Asvir. For example, the Lemivir, Ledip, Ledipasvir. So Ledipasvir and Sofosbuvir and the Semiprevir are used as a combination therapy for the treatment of hepatitis C. And the last one is Ribavirin, and we give Ribavirin, which competitively inhibit the inosine monophosphate dehydrogenase, and this enzyme is important in de novo purine salvage pathway. And this ribavirin is very much toxic to the red blood cell, that is, it can cause hemolytic anemia, and also it is a severe tetratogen, not used in pregnancy, and it is used as an adjuvant when there is a refractory cases of hepatitis C. It is used as adjuvant. So this is all about the therapy of antiviral medications.